we see in this picture, we are able to identify that there are lots of RBC, and these RBC have no central pallor. Whenever I see a RBC, normally in the normal peripheral smear, I have to have 1/3 central pallor in that RBC. Okay, so this is a normal RBC. It has 1/3 central pallor. This is a normal RBC. First thing. Second thing, if you see a RBC which doesn't have any central pallor, which we saw just now in this particular smear, RBC without central pallor, then we call it, yes, spherocytes. No central pallor, बीच में बिल्कुल भी हाइपोक्रोमिक एरिया नहीं है. ये सेंटर का जो एरिया है ये एब्सोल्युटली पिंक है. तो RBC with no central pallor which we are seeing here is known as spherocyte. So we are dealing with spherocytic anemia here. Spherocytic anemia in a child. What is our diagnosis? What is our diagnosis? Remember, spherocyte have many differentials. It has got many differential. If you see spherocyte in a child, then most probably you are dealing with hereditary spherocytosis. In a case of adult, you are most probably dealing with AIHA. But these two are not only the differential, we have many other differential too. I have a spherocyte in this smear. If you see this particular smear, go back to the question again and look if they are giving about child with anemia. Particularly this question, this patient was child with anemic, but they can change the question and then you can have adult with spherocytic anemia. There can be an adult with pancytopenia and spherocyte. There can be adult who is having hemoglobinuria and history of drug intake. 4 different key points can be there in the question. If you have spherocyte in a child, most probably you are dealing with hereditary spherocytosis. Hereditary spherocytosis is a congenital anemia present in a childhood mostly. Adult, if a patient comes in an adult life with spherocyte in peripheral smear, most probably you are dealing with autoimmune hemolytic anemia. Autoimmune hemolytic anemia is the most common cause of spherocyte in adult, and overall also it's a most common cause. Overall most common cause of spherocytes. Third situation, where patient is having pancytopenia. Okay, patient is having pancytopenia plus there are other feature, for example thrombosis of superior sagittal sinus, hepatic vein or superficial blood vessels. If you are having this particular history, pancytopenia, thrombosis, spherocyte, you are dealing with patient of PNH, paroxysmal nocturnal hemoglobinuria. Fourth situation, hemoglobinuria, history of drug intake, history of infections, most probably you are dealing with G6PD deficiency anemia. So friends, what we learn here is spherocyte is not a disease itself. It's a condition which can have multiple differential. For example, hereditary spherocytosis is the first differential if you are dealing with a child. Okay. AIHA, autoimmune hemolytic anemia, is the second differential if you are dealing with the adult. Third differential is PNH in the case of pancytopenia, thrombosis, etc. Many other symptoms can be there in the PNH. Okay. And fourth differential is G6PD deficiency anemia. Tell me friends, what is the most common cause of hereditary spherocytosis? If you are dealing with the HS, what is the most common cause. Most common cause of HS is ankyrine deficiency. It is ankyrine deficiency which is the most common cause. In the case of AIHA, most common cause is autoimmune diseases. Although most of the AIHA are idiopathic, we do not know the cause. But if you are asking particular reason of the AIHA, say it's an autoimmune disease. Cause of the PNH is deficiency of GPI anchor protein. There is a decrease GPI anchor protein in the case of PNH. For example, decrease CD59, decrease CD55 known as MIRL and DEF. And cause of G6PD deficiency anemia is deficiency of enzyme G6PD. So these are the most common causes of 4 different situations. Okay, they can ask another question, not about the cause of spherocyte, but they can ask the most relevant investigation or next investigation if you are saying spherocyte. Okay, so if you are looking at the smear spherocyte in a child, the next best investigation is going to be osmotic fragility test, OFT. This is the next best investigation. Okay, but in the case of AIHA, autoimmune disease, we can do Coombs test. Direct Coombs test is going to be the best in this situation. In the case of PNH, our best investigation is flow cytometry. Although HEM test is the screening test, but we don't do it that commonly because it's very non-specific. We go for flow cytometry of CD59 and CD55. In the case of G6PD deficiency anemia, we can do enzyme assay directly. So most important investigation, next best investigation can be 4 depending on the key feature provided in the question. In the child, OFT. Adult, Coombs test. In the case of PNH, flow cytometry, and G6PD deficiency, enzyme assay. But they can ask directly. For example, in the AIMS, they will usually combine the 2 things, smear, then what is the treatment of choice, smear and what is the investigation of choice, like that. Okay, so spherocytic smear, and they are asking what is the treatment of choice, TOC in the case of spherocytosis. So if we are dealing with HS, hereditary spherocytosis, treatment of choice is going to be splenectomy, removal of the spleen. Spleen is the culprit organ in the case of spherocyte. They eat all the spherocytes, so we are going to remove it. Okay, in the case of AIHA, autoimmune disease, we can start with steroid, which is the drug of choice. Okay, which is the drug of choice in AIHA. Obviously, prednisolone is the most favored drug when we take steroid as treatment of choice. Okay, for the PNH is a stem cell disorder, and because of that, we have to give new healthy stem cells to the patient, known as stem cell transplantation. Stem cell transplantation is treatment of choice of PNH. And in G6PD deficiency anemia, what we can do? We don't have G6PD capsules. Okay, so we cannot give G6PD directly to the patient. Maximally, we can help them by giving blood transfusion. The most important thing is you have to prevent G6PD anemia symptoms by preventing the culprit drug. So prevention is the main thing. Okay, so friends, this is the complete approach of spherocyte in a smear. Okay, a child with spherocyte, HS, ankyrine deficiency, OFT, splenectomy, most important FCQ. Adult with spherocyte, AIHA, most common cause autoimmune diseases, especially SLE is the most common cause, and in the malignancy CLL is the most common cause. Okay, in a case of spherocyte with pancytopenia, PNH is the answer, flow cytometry is the IOC, SCT is treatment of choice. And in the case of G6PD deficiency anemia, patient will have spherocyte in the smear, he will also have hemoglobinuria, enzyme assay is the investigation of choice, and prevention of the further attack is the main focus here. Now you attempt this question again. What is the key feature here? Key feature is presence of spherocyte in a child. What is diagnosis? Yes, HS. Because diagnosis is HS, what is the most common cause? Ankyrin deficiency. Remember, ankyrin deficiency is the most common cause, but spectrin deficiency can cause most severe form of HS. Ankyrin deficiency is autosomal dominant condition, but spectrin deficiency it autosomal recessive. So recessive form of HS is most severe and dominant is the milder one. Okay, band 3 deficiency can also be there. Glycophorin deficiency will never cause HS. So all of these are causes of HS, ABC, but the most common cause is ankyrin deficiency. Investigation, next best investigation is OFT, treatment of choices, splenectomy. Thank you.